topic we'll discuss is grooming and dressing a resident. So when we're grooming a resident, one of the things that we do is we want to, of course, do their hair, because everybody tends to feel better when their hair's brushed and if it looks nice. So we can always do that for a resident if they can't do that themselves. So if a person can do their own hair, of course we're going to let them. We can hand them their hairbrush, we can let them brush their own hair, we can let them style it if they're able to. But if they're not, it's something we can do for them. Now, most nursing homes will usually have a beautician that comes in. Many of them have a beautician that comes in once a week or once every other week, but it is an extra service that the resident actually pays for. So in between then, of course, they're going to be really excited probably about having us do it for them. So when we're giving hair care to a resident, we do want to make sure that the hair is clean. Most of the residents have their hair washed twice a week when they do their showers. So twice a week they go in for their showers and they shampoo their hair. The other days we generally don't wash the hair. You have to remember with your elderly population, their hair dries out. It doesn't get really oily, so it doesn't usually need to be washed quite as often. Though if they do want it washed more, we can do that for them, and we will be teaching you how to wash someone's hair in bed if necessary, or we can always take them into the shower more often if needed. Generally, when we brush the hair, we start at the scalp and we work our way down the hair. So helping brush that scalp, it tends to stimulate blood flow to the scalp. But generally, we start at the scalp and work our way down. The only way we don't do it that way, where we're going to actually do it in a reversed order, is if it is extremely tangled. So if it's really tangled, you can start at the ends and then just work your way up little by little, trying to get those tangles out. You should not be cutting their hair, just because it's tangled. I thought this was really cute. This is full of knots again. Girls' hair is just so much easier to brush. Generally, obviously, that's not true. Usually girls have longer hair than men. Not always, but usually. So that is just, I thought it was really cute. When we are shampooing hair for a resident, as I mentioned, usually it gets done usually twice a week when they go into the shower room. If they need a medicated shampoo, like a dandruff shampoo or some kind of medicated shampoo, Ridix, if they have lice, something like that, then we would get the medicated shampoo from the nurse. And they'll usually just give it to you in a cup for you to pour on top of the head. Usually medicated shampoos, if they are on a medicated shampoo, make sure you check with the nurse. How long are you supposed to leave it on the scalp? So sometimes you're supposed to put that medicated shampoo in and get it really lathered up and let it sit there for a couple minutes before you just rinse it off. So they make different types of devices. If it's not their shower day and they want their hair washed, they make these type here that kind of wrap around the neck. They inflate. You just blow them up, and it will help catch the water. And we'll show you some different variations in clinical of things you can do to wash someone's hair. But always make sure when their hair is getting shampooed that we cover their eyes. We take a small, clean towel and actually cover their eyes up so they don't get shampoo or water running into their eyes when we're doing this. And if we observe anything abnormal, bugs, lice, dry, itchy areas, parts that are hurting them when you're shampooing their hair, that is something we, of course, would let the nurse know. Now, shaving residents, both men and women can be shaved. So when we're shaving someone, and I'm not sure why this happened here like this, when we're shaving someone, we do want to think about an electric razor versus a safety razor. So a safety razor is like a disposable razor. They have a safety strip on them. Those are usually what you're going to shave with in the nursing homes and in the hospitals. But if the person wants their own electric razor, their family will bring it in for them. Generally, we do prefer to do electric razors when we have patients that have dementia and they get aggressive. Much better to do it with an electric razor, because if they're fighting you and you're using that sharp razor, it's easier to nick them. If you have patients with tremors, so in a later class we'll talk about Parkinson's disease, and with Parkinson's disease a person has like uncontrollable tremors. When you have patients with tremors, you want to keep that in mind, that maybe that's not the best person to use a safety razor for, because if their head's shaking, obviously it's going to be easier to nick. And then people that are on blood thinners called anticoagulants, because if we nick their skin, there's going to be a chance that it's going to just bleed excessively. Before we shave, we want to soften the area up, and the best way to do that is with warm water. So you just usually get a warm towel, wrap it around the face for 3 to 5 minutes, and just hold it there. Best time to do this is if you're taking your patient into the shower room and that hot steamy water is going to already have it softened up. You won't need to soak it for a while, but if you're doing it in their room on a daily basis, we would just soak the face for about 3 minutes. You put on the shave cream, and then if you're using that safety razor, you want to hold the skin taut or tight, and you come in down. You go in the direction of the hair growth. Now when you get to the jaw, you may go at an angle, and sometimes around the chin you're doing tiny little strokes. As it's getting all that shave cream and hair that you're cutting off, just rinse it off, and you can bring a little basin of water, rinse it off in the basin of water, and then you keep going. Now for face, we shave in the direction of hair growth. Underarms, we go in the direction of hair growth. Legs usually go in the opposite direction. Now most of the facilities do want us to shave the men's faces, but as far as underarms and legs, by state law, it's something you're allowed to do, but that's by facility by facility. So, for instance, one of the facilities we go to, they do allow us to shave their legs, the women's legs and underarms if they want. The other facility, one of the facilities we go to, they don't want us to do that. And so some of the women complained so much because they weren't getting their legs shaved that they started buying electric razors for their legs. So it will depend on the facility that you're working at. We should be wearing gloves when we shave, only in case we nick the skin. So if you nick the skin, the best treatment for that is direct pressure. You just take a little piece of gauze or a little paper towel or something, just put direct pressure on it. So you are going to want gloves with that. And why are we not moving now? There we go. As far as nail care goes, so with nail care, we do want to keep their fingernails clean, and we want to make sure that they are soft, or that they're smooth, that there's no jagged edges to them that they could scratch themselves with. And this is true for you as well. Your nails should always be short. This is about the longest your nails should ever be when you're caring for a person. You should not see the tip of your nails. If you turn your hand over this way, you should not see the tip of those nails. That is about the most nail you should have in nursing. We cannot wear gel nails or artificial nails because they can get fungus in them, and it has actually happened where they've had fungal infection spread from the nurse's nails to the patient. So generally when we do nail care, we soak the fingers for 5 to 10 minutes. And then when you cut the nails, you cut straight across. So you cut straight across, and then you take an orange stick. It's not actually orange in color. It looks like a regular wood stick. I think it was probably originally made out of orange wood. Has a flat end on one side, and you take that flat end and you come underneath the nail, and then you wipe off the dirt. You come underneath the nail, you wipe it off. So we clean with an orange stick, and then and then you can take an emery board to shape it. So you take an emery board to actually smooth off those rough edges and to put it in the shape that the patient wants it. We do want to make sure that after you soak those nails, of course, you dry completely, and after you've cut and you've cleaned and you've shaped them, we can apply lotion, do a little hand rub for them. If you have a resident that wants nail polish, we can do that as well. But if you just put lotion all over their hands, you might need to wipe the lotion off to get the nail polish to stick for you. Now, foot care can be a little bit different. With foot care, we generally soak the feet for 15 to 20 minutes. So 15 to 20 minutes. And we do not cut the toenails. So you are allowed to cut fingernails so long as it's okay with the institution where you work. But generally most of them will let you cut the fingernails. Sometimes they'll ask you, like one of the facilities we go to, they want the students to come in and check in with the nurse first before they just automatically do it, just to make sure if the person has any, like if they're diabetic or if they have any vascular, poor blood flow issues, then they may tell you not to. But with foot care, we can soak the feet for 15 to 20 minutes, but we don't cut the toenails. They don't want the CNAs to cut the toenails. So if you think the patient really needs their toenails trimmed because they're really rough or really long, they actually have a podiatrist that usually comes in every other week at some places, every month at some places, and you put them on the list for the podiatrist to do it. Because if a lot of our elderly population has poor circulation to their feet, and if you cut their toenails and you give them an ingrown toenail, or you cut it too short and you nick part of the skin, their feet don't always heal sometimes when they get wounds down in the feet because the circulation is so poor. So they don't want the CNAs cutting the toenails. But you can soak them for 15 to 20 minutes. You wash and dry them off. You can put lotion on the top of the feet and the bottom of the feet, but we don't put lotion in between the toes because, again, remember, bacteria likes warm, dry, or warm, moist areas. And when your toes have lotion on them, they're warm and they're moist down there. So we don't put lotion in between the toes unless it's a medicated lotion. If it is a topical, over-the-counter medicated lotion, like if they get an antifungal cream to their toes, an athlete's foot type of cream, that we are allowed to do if the nurse says it's okay. And then when we're done, they should always be back in non-skid footwear, either the non-skid socks or shoes. Now, as far as changing clothes, so in a hospital setting, people don't generally get into their clothes. They usually wear a hospital gown, and we just change their hospital gown as needed. And the nice thing with the hospital gowns is that in most hospitals, the hospital gowns have snaps up the sleeves. So even if they have an IV, you don't have to worry about taking the IV tubing off, running it through the shirt, and then putting it on. You can just unsnap the sleeves and snap them back around. But in the nursing home, again, this is their home, and they like the patients to be cleaned and dressed every day and really encourage them to get involved in activities. So we will always want to give them choices. Let them choose what they want to wear. Provide privacy, obviously, when we're dressing them with their privacy curtain. And if they have a weak side, so if a person has a weak side, we remove clothing from their strong side first, their unaffected or strong side first. That comes off first, because the first sleeve, like if you were trying to get my t-shirt off, the first sleeve is going to be the hardest to get off. So if you're going to do it on my strong side, so I can help you move that side so you can help get the shirt off. Then once that shirt's off and you bring it over my head, it'll just slide off the weak arm, because I'm not going to be able to help you with that one. And then when we dress the person, it goes in reverse. You put the weak arm through, because they can't help you with that one, and the first arm's going to slide through, and then you put it over their head, and now the second one, that's harder to get on, but if you've got their strong arm, they can help you with it. So if they have a weak side, we undress strong side first, we dress weak side first. And if we have an IV, remember with IVs, kind of treat it like a weak side. You've got to be really careful when you thread that bag and that tubing through, if they don't have the snap type of gowns. The other thing you can do is if it's on a pump, you may have to get the nurse to help you. You may actually have to get the nurse to take it off the pump and thread it through the clothing, and then you can help bring their arm through it, and then the nurse will put it back on the pump for you. So changing clothes with a weak side is a skill of state competency. So it's very important that you get those two down as far as which one do you undress first, which one do you dress. And sometimes they'll call it an unaffected side and an affected side. Unaffected means it's strong. It hasn't been affected by the illness. So unaffected is the strong side. Affected is the weak side. Now, there are adaptive devices as well. So generally, the physical therapist comes in. So a physical therapist will help the patient learn how to walk again, how to get upstairs, large motor movement. But then they have occupational therapists, and occupational therapists are the ones that teach them how to dress themselves again, how to brush their teeth again. If they're suffering from an illness and they're having to relearn those things. And there are adaptive devices. There are things to help slide your shoes on. There are things to grab it so you can help, so you don't have to bend over so far. They have devices to help get your stockings on. They have devices to help bring buttons through shirts. So there's a lot of different devices out there to help a person accommodate for any disability they have, so they can still be as independent as possible and dress themselves if possible. And so that is going to end our topic on grooming and dressing.